see.
Thanks, Rachel, and thank you all for joining us today. I just want to extend a word of welcome. We are, of course, thrilled that we're in a place where we are training and supporting all of you to integrate CORE into your operations so that we can be fully operational as a wider association and field and using CORE moving forward. So super grateful to you and all of the leaders who have come before all of us in this adventure that began in 1984 for Minnesota. And we are very excited about the impacts yet to come. I'll pass back to Rachel Peterson to facilitate today's training. Thanks, everyone.
Thanks, Kirsten, and welcome, everybody. We're really excited to host another training on CORE today on the discharge form. I'm going to do a screen share. Give me one moment here. All right, so today is the discharge form user training. Last week we had the intake form training, so we're kind of moving right along, which is great. As Kirsten mentioned, we're preparing for a January 18th system launch. So a little history, and I know for some of you, you've heard this before, but I think it's important to lay it out for those who have not been on one of the trainings yet, or the webinar or the training, the intake form training. So a little background information. In 1985, Aspire Minnesota, it went by the name of Minnesota Council of Residential Treatment Centers at that time, received funding from the Bush Foundation to develop and implement the Student Data Reporting System, which some of you know as the SDRS. And for over 35 years, this system has provided member organizations with the ability to report on outcomes data, demonstrate efficacy, and promote improvements in service delivery while driving important discussions with partners and legislators, funders, and others. At the request of and guided by the Aspire Minnesota membership, we've been conducting a complete system upgrade, renaming SDRS the Children's Outcome Reporting and Evaluation System, CORE. Unlike SDRS, CORE is designed for all children's service providers. So residential treatment, outpatient and related community-based services, and foster and relative care. After hours of debate and exchange over the past years regarding which data should be collected through CORE, data fields have been carefully curated by research and service leaders to ensure that the data would have immediate value for our goal of increasing understanding of services and promoting increased quality of services. CORE has been designed to capture data that otherwise is not being reported. Data determined to be nice but not necessary will not be collected by CORE. Some parts of CORE are more clinically oriented, and the design allows for services that are not as clinical to continue to gain value from the data collected and outcomes reported, including foster care, services for youth experiencing homelessness or sexual exploitation, nurse home visiting, etc. A briefing webinar about CORE was held on October 28th, and then the CORE intake form user training, which I know a number of you attended, was held on December 15th. And both of those recordings are available on the AspireMN website, www.aspiremn.org, under the, under the CORE tab, which is farthest to the right on our webpage. And if you haven't had a chance to watch those, I really encourage that. The webinar gives a really great overview of the CORE system in its entirety. And then the intake form training focuses in on the intake form specifically. And then my email and phone number are included on the last slide of this presentation. And as you're watching those recordings, or if you're watching this recording, you can always reach out to me at any time with any questions that you have if your questions aren't asked during the Q&A during this training. There are a lot of people that have been working really hard on bringing CORE to life over the past years. The Aspire Minnesota core team includes Dawn Peterson from Northwood Children's Services, Heidi Seaton and Whitney Loisel from North Homes Child and Family Services, and Dr. Anita Larson and Elena Gunther from Nexus Family Healing. And then advising on content, reporting, and research potentials are Dr. Tracy Liliberti and Dr. Christy Peischer from the Center for Advanced Studies of Child Welfare at the University of Minnesota. And then we've got our team of developers from Educational Technology Innovations at the U of M, leading all of the important technical development of this application. And a handful of our colleagues at ETI and CASHU are on the call with us today. So moving forward, there are 5 main components of CORE. You've got the intake form and the discharge form, which we'll be focusing in on today. And then there's the 6-month follow-up form, so 6 months after a client is discharged, and satisfaction surveys that are also sent out after a client is discharged, and then the reporting feature. So the intake and discharge forms and the reporting are the pieces that staff at Aspire Minnesota member agencies are responsible for, which is why we're kind of starting with these 2 intake and discharge pieces. The 6-month follow-up forms and satisfaction surveys will be sent via text message or email. First choice being text message, second option is email, in order to make it as easy for all of you, the staff at our member organizations. So that process will be automated, which means that you won't have to deal with sending those out and or dealing with the responses, because those come directly into the core system, which is really great. For those of you using SDRS over the past years, you know that sending out those follow-ups and satisfaction surveys, it's a lot. So this piece will be very different moving forward. So the purpose of today's training is to equip Aspire Minnesota member organizations to begin utilizing the core discharge form in 2022, right around the corner. So we're going to dive right into the discharge form. And if you were with us for the intake form training, it'll be quite similar. And some of it will be very familiar because, of course, the discharge mirrors in a number of ways the intake form. And the discharge form is a briefer document or a series of screens. And so I have gathered the screenshots that cover the entirety of the discharge form. And when there's a drop-down menu, obviously on a screenshot, you can't see that. So I will read those, the options that are included in each of the drop-downs. So we'll start right off the bat with the client demographics. And here it asks for an ending service date. And then, is the client's primary household the same as at admission, yes or no? And then for grade level at discharge, the options there are pre-K, kindergarten, then 1st through 12th grade. Then there's an option for enrolled in GED. There's an option for graduated/GED or not available. So, and I do realize that I forgot to mention that we, if you have a burning question as we're walking through this, feel free to shout it out. There is time dedicated at the end too for Q&A. So, and also my AspireMN core and ETI colleagues, feel free to jump in if you want to clarify or add to anything that I'm articulating. So moving on. Here we have the health and safety section of the discharge form. So here, what's going to happen is there's a question: has the health status of the client changed since intake in any of the areas provided? So if the answer is yes, you'll click yes, and then you'll check only new information not given at intake. So if the client has developed asthma, you would click on asthma. And I believe that we're going to be doing it in such a way that you can't see here, where the ones that have been checked in the intake form will be visible, so that you can see without having to go back to the intake form which options were selected. So moving on, let's see. Well, receiving services, have there been any new findings of maltreatment by caregivers? And so here, the options are the same as on the intake form. You've got mental injury, neglect, physical abuse, sexual abuse, threatened injury, or sexual exploitation. And you can choose from documented, suspected / not documented, or none known or suspected. And these definitions of suspected / not documented and documented, et cetera, those will be included in what we're calling the user manual. And you'll be able to click on little question marks, like icons throughout the core system that will bring up pop-up boxes with explanatory information so that, if you're kind of wondering, well, what specifically does suspected not documented mean compared to none known or suspected? You'll get a definition there. And then the question, has an adoption of the client been legally finalized while receiving services from this agency, or is the client a ward of the state? Moving on to the services and treatment portion. There will be a couple of small updates to the options that you're seeing here. We just made those on today, actually. So, and there are, I think, 4 sections, and you're seeing the first 2 here. So what therapeutic services did the client family receive during the service episode? And we're going to include in the other one, so one of the changes that will be adopted is where it says other on this section in particular, there'll be a write-in option so that we can collect data on other services that are common that we should then add into the main checklist. And then there's what medical services did the client receive during the service episode? And the next 3 sections, there were 5 in total. What development services did the client and family receive? And then current school-related services, and what community activities was the client or family involved in during the service episode. And I mentioned this during the intake form training last week, but as you're looking through these lists and you see things that are confusing, or if you think that something is missing that really should be on there, by all means, reach out and let us know. We had some really good feedback during the intake form training, kind of in that vein. So I'll just give you a minute or a few seconds to kind of observe this list before we move forward. All right. Here we have a question about how involved with the client during care was the family. And then we have social worker or probation officer. Probation officer will be written out. And you can select from any of those. They're mutually exclusive, so you select one of the options: very involved, uninvolved, minimally involved, very involved, or not applicable. And then how supportive of the client's program was the family, social worker / probation officer. On the discharge and plan section, there are a number of drop-down menus that I'll read the options aloud. First question, though, is were the treatment plan goals completed, yes or no? And then for this drop-down menu, the discharge was initiated by, the options are agency foster parent, the treatment program, court, county social worker or probation officer, child / runaway, the parent, or the health plan. And for the post-discharge living arrangement, the options there are parents' home, they're living independently, pre-adoptive placement, homeless shelter for youth only, transitional living program, a relative placement, a foster care home, group home, shelter or shelter foster care, inpatient psychiatric hospital or residential treatment program. Was the living arrangement recommended by your agency, yes or no? And then for the next dropdown, what is the school plan? The options are public/private school, technical/vocational school, day treatment, including education program, completed school/GED, no school plan, other, or unknown. And then for what is the occupational plan for this client, the options are there: full-time employment, part-time employment, temporary work, no employment plan, other, unknown, or not applicable. So move on to the next slide, which is the final slide in the discharge form, which is related to the assessments. So some Aspire Minnesota member organizations administer client assessments on intake, and others do not. So if you are an agency that does not administer assessments, this particular section we see here will not pop up for you. You'll be able to bypass it in the intake form and thereby bypass it in the discharge form. For those entities that do administer assessments, you'll need to re-enter final scores or re-administer the assessment and enter final scores. In some cases, it'll ask for sub-scores for the categories for whichever assessment or assessments that were included in the intake form. And there are 6 different options. It's the EXE, the CASI, the SDQ, POSIT, CANS, and the youth level service inventory. Those are the 6. And if you do administer assessments, you'll need to select at least one of those in the intake and then repeat that assessment in the discharge. And then I'm realizing that it didn't show up in the screenshot, but there is another section of assessments that's really important, and it's the trauma assessment. So one really great asset of the core system is the inclusion of the University of Minnesota's 5-question traumatic stress screen for children and adolescents, the TSSCA. That screen was designed to provide practitioners with an efficient yet precise tool for screening and identifying children ages 5 to 18 that may have experienced a traumatic event, and in so doing, equip member organizations with a greater understanding of trauma symptoms so that services can better support the child. It is a 5-question tool, so it's quite brief. And so that one is going to be required for all member agencies participating in CORE. So that's a little bit about the assessments. And with that trauma assessment, again, you would administer it at discharge as well and see if there's any change. So before we move on to the Q&A section, I just wanted to mention that we're at the request of members at the intake form training, we're going to be developing a desk guide that covers all of the elements of the intake and discharge forms. And we'll share that with everybody so that you could see the content and really familiarize yourselves with it before we launch in January. So that will be shared with everybody. It'll be posted on the CORE tab on the AspireMN website as well. So we're really grateful for that suggestion, and we're in the process of creating that right now. So I'd like to first open it up to any of the Aspire Minnesota CORE team members to jump in if you have anything that you'd like to share. Here's also my contact information for folks. So I know that Heidi, and I think I saw Elena and Whitney and Christy, Kirsten, if anyone has, I can't see everybody as I'm sharing my screen, but if anyone has anything that they'd like to add before we open up for Q&A, feel free to jump in. All right, let's open it up. I'm going to take my screen down so that we can see one another.
I'm glad to facilitate this Q&A as well. Very nicely done, Rachel. Thank you. Thank you, Rachel, and thank you everyone for, again, these conversations. One question here on the chat is, for the services received section, are those only services provided by the agency completing the form in core? I'm thinking of targeted case management clients who typically get services from a variety of providers.
That's a good question. My feeling is that it's the services strictly provided by your entity. But feel free to jump in, Kirsten, Christy, Heidi, Dawn, if you're on here, if you have a different opinion. The goal being to really track on what on the services that you are provided. Heidi, I saw you unmute.
I was just going to agree with you. I think it's specific to that service or program that they're in.
Thanks, Heidi.
Another question would be,
hang on, I have a follow-up. Sorry, this is Drea from Heartland. So with that, a lot of our, we provide a lot of services, but we contract out because we're in a really rural area. So would we count that, for example, like every kid who comes to our program does individual therapy with one of our contracted services? So it's not like they're coming with their own, they're getting them while they're here. Would that still count? Like, would we be checking those boxes, or would that be like, we're not technically providing those services?
Yeah, that's a nuanced situation. My feeling, again, Heidi, jump in, is that yes, because every client is receiving that individual therapy service, even though it's contracted out, it's part of your program, then yes, you would select that.
I would agree with that too.
Great, thanks for the questions, everybody. Keep them coming.
Yeah, that's really helpful. Part of this, well, there will be, some resources attached as you are filling this out, you'll be able to see some of those frequently asked questions embodied in the tool and delivered in other ways, potentially as we continue to answer, develop our own and answer questions. And I think that you are not alone at Heartland. And I think this would be one of those FAQs we want to make available to everyone. So thanks so much for that question. Another question, would staff resignation be an option for initiating discharge?
Staff resignation, was that the question, Kirsten?
Yep.
Gosh, could someone elaborate on that?
When you were reading off the reasons for discharge, I was just wondering, we have situations where if a staff leaves, services have to end because we don't have staff to fill in right away. So that would be the reason for the discharge. And I didn't hear that as an option.
Okay.
That was my question.
Yes, that is not on our list, but I think you bring up, Sarah, a good point. So we could include that on the discharge form. Staff resignation.
Thank you.
Yes, thank you.
I would maybe just make note, Rachel, referral to set another provider to go along with that, because I would assume they're all being referred elsewhere.
Got it. Thanks, Heidi.
Another question is, when will the traumatic stress screen for children and adolescents be available for agencies to administer?
It will be available when we launch on January 18th. So it'll be included in core because it's such a brief 5-question trauma screen. And I'll also include it in the desktop intake and discharge guide as well, the 5 questions that are in that trauma screen. So it will be built into core, but you'll have a chance to familiarize yourself with it ahead of time as well.
And we did have some conversation with Abby Gerwitz and Chris Bray over one of our virtual member meetings about this screen, but I think we'll plan to do another update for folks in January about the screen because it is, a real asset and distinguishing feature of CORE. But more important, it is something that we hope will be really a valuable driver to some of the responses that you and your service and treatment response have for kids and families. So I want to be really equipping everyone with that full picture so you can best use that information as well. Another question is, how many attempts does the system make to collect satisfaction survey information if it is not responded to initially?
So we had this conversation a number of months back, and I think the system will be set up in such a way where it'll automatically send a reminder if it has not been received. And I don't recall, core team, were we going to send 2 reminders and then just let it be? That's in my mind. That's what kind of where we landed. You send it out originally, and then there will be up to 2 reminders at sort of a specific time period.
Thanks, Rachel. The other question that we see here is, for the section about involvement with social worker PO, would it be possible to have separate choices for each team member? We have had situations where social work isn't very involved, but the guardian ad litem or someone else is.
Yeah, sure. We can pull those out so that so you'd want to have, just so I'm understanding correctly, social worker be separate from probation officer, separate from guardian ad litem. We can do that for sure.
Yes, thank you is the response, Rachel.
Is there any chance we can get like a tribal worker box put on there? Because we have our program, sometimes we have like 2 different social workers, like a tribal worker and a social worker. So it would be really nice if we could, along with the addition of like adding the probation officers and stuff, if there could be a box for a tribal affiliate.
Yes, and actually, thank you for that comment. That tribal worker is included on the discharge on the intake form, but for some reason just didn't show up on the discharge form. So yes, that's a great point. I will add to separate out those categories and then also include guardian ad litem and tribal worker.
On that note, this is Jill from North Homes, and I was going to email Heidi. On the adoption piece, has the youth been adopted? Could you add TLC, because that's a lot of ours with the tribal agencies.
Got it. Thanks, Jill.
You're welcome.
We have 2 other contributions in the chat, wondering if we could add mental health caseworker, and another request for adding a targeted case management line.
I'm just jotting down notes here. And the second one was targeted case manager.
Right.
Okay. Great. Are there other questions? I'm going to allow for an awkward pause. Just want to make sure that folks have a chance to ask those questions. And again, if you're viewing the recording of this, feel free to reach out to that email or phone number that was included on the final slide. I'm always happy to be in dialogue about stuff.
Can I ask one more question?
Of course.
So when you were talking about the trauma screener, just to clarify, every agency that uses this will use the 5-question trauma screener, even if we have our own that we already do?
Yes, that is correct. That is one. We know that for a lot of folks, this will be in addition to something that you're already doing, but the planning committee really felt it was important to have this shared metric across all Aspire Minnesota entities. And that's why it'll be included for even agencies that don't administer the other assessments. So it'll be a universally included across the core system. And as Kirsten mentioned, we'll be doing a more in-depth training on that tool in January, so you can learn more about it. All right. Well, thanks everybody for joining today. And again, feel free to reach out at any time with any questions. We want to make sure that everybody feels really equipped to start using the intake and discharge forms in 2022 in January.
Rachel, there is one more question that just popped up. Is there an estimate of how long it is anticipated the intake and or discharge form will take to enter?
That is a great question. I might push that question over to Heidi or Whitney or Elena if you're with us, as I have not done intakes myself.
I don't think it'll take that long. We tried to keep that in mind as we were developing them and developing the types of questions that were being asked. We didn't want there to have to be a lot of back and forth and maybe looking for information that wasn't readily available. We can maybe do like a trial run though and get a better answer on that. Off the top of my head, I'm thinking maybe less than 10 minutes at the most, but that's a complete shot in the dark. But I think we could certainly test that and get a better idea of what that looks like.
Thanks, Heidi. And we've touched on this before, I think in the discharge form training and the intake form training last week and the webinar, that another big must-have for CORE is the ability for those who use EHRs to transfer over their demographic data automatically. And that is a work in progress. It's a complex thing for our developers to nail down because there are so many different EHRs and EMRs being used across the association. But that will be possible in the future, which will again eliminate, for those of you that use those EHR systems, will cut down on the time for an intake and discharge form.
And to that end, as is commented in the chat, when the EHM, EMR is connected to CORE, that also may speed things up.
Yes.
It's a question in the comments, but it's a statement that is true.
Yes. Excellent. All right, I'm going to pause once more here. All right. Thanks again, everybody. And wishing everybody really peaceful and safe and healthy holidays. And there will be a lot more CORE in January as we get close to launch. So stay tuned for more announcements and invitations to trainings. Thanks, everybody.
Thanks so much, everyone.
Happy holidays.
Thank you.